Hello, I'm Jessica and I'm a pharmacist who's just completed a one-year pre-doctoral fellowship with the NIHR Applied Research Collaborative in Greater Manchester. For the past 15 years, I've been working on oncology, helping to optimise the treatment of people with cancer, whether that's through supporting selection of the most appropriate anti-cancer drug and dose, or helping to find the right supportive care to manage the symptoms of cancer and the side effects of treatment. Increasingly over recent years in oncology, we've had the advent of genomic testing, meaning that we can test tumour DNA to help identify which tumours are most likely to respond to newer targeted medicines. In 2022, I completed my Masters in Genomic Medicine and learned more about the possibility of pharmacogenomic testing of a person's own DNA to personalised treatments. People often respond differently when they take the same medicine. For some, it might work well, for others, it may not have any effect, and still others may get side effects. This can partly be explained by common variation in our DNA, also known as pharmacogenomics. It's possible to test for single gene changes or lots of genes at once, which is known as panel testing. As a cancer pharmacist, I wanted to use my pre-doctoral fellowship to learn more about how this kind of testing could be used in the care of people with cancer. Specifically, I want to understand what's the evidence supporting using pharmacogenomic panel testing in adults with solid tumours to improve their care. What are the views and attitudes of the public, including people with lived experience of cancer treatment, towards having this type of testing? What do they think are the important questions to ask? And what are the views of oncology healthcare professionals towards introducing this type of testing within cancer pathways? To meet these objectives, I set out the following plan for the year. Firstly, to undertake a systematic scoping review of the literature, to complete the Cochrane modules on systematic review, to engage with key stakeholders through public engagement and by surveying oncology healthcare professionals, to disseminate my research through conference attendance and publications, and to use this information to prepare a PhD proposal. Over the course of the pre-doctoral year, I had a number of opportunities to train and develop my skills as a researcher. Firstly, through undertaking the Cochrane modules, I learned the important facets of writing a systematic review protocol and discovered new frameworks to help support the development of my protocol. Although I'd done scoping review during my Masters, I hadn't written a standalone protocol, so I learned about the need to write and register this separately. I also discovered new online screening tools like Rayan, which made collaborative abstract screening much simpler thanks to my supervisors. One of the biggest benefits of doing this pre-doc through the ARC was the access to patient and public involvement and engagement participants through the YPAG and peer supporters. Anil and Joanna were so supportive in helping me access the PCI group members and understanding what information they needed from me in order that they could contribute meaningfully to my research. I was able to share my research plan and systematic review protocol with them and then present at a webinar before I registered my protocol. It was a really good opportunity to develop my skills at communicating my research ideas in lay terms, and I also got some really valuable feedback on ensuring that I was able to capture data on using pharmacogenomic testing across diverse patient groups during my data extraction. Through being part of the ARC, I became aware of and had the opportunity to attend an in-person workshop for researchers about the value of co-design and collaboration with community champions when developing PPIE as part of research. This gave me a great insight into developing a relationship with patient and public participants, the importance of remuneration and appropriately valuing the time and contribution to research, and the need for clarity around expectations, especially when working with partners. Subsequently, I was able to present at the ARC's Dragon's Den event, which gave me another opportunity to share my research proposal with members of the public to get their input into designing my intervention and the best approach for designing qualitative aspects of my research. Their input has strengthened my desire to involve people with lived experience of cancer treatment in the design of the intervention, as well as being research participants. I'm using this to bolster my request for involvement of cancer patient groups to develop my PhD application and doctoral research. In order to assess the views and attitudes of oncology health professionals, I worked with my supervisory team to develop a survey which could be circulated around cancer professional groups. This was my first experience of leading on quantitative research of this nature, meaning that I learned about how to assess the requirement for ethical approval from NHS and the HRA. Ultimately, the University of Manchester's tool indicated that my survey would not require ethical approval, since it was a survey of healthcare professionals and not sensitive information. However, I was able to obtain ethical exemption from the university in order to meet publication requirements. A huge benefit of the research fellowship has been the protected time it has allowed me and the confidence it has given me to network more proactively regarding my research. I would say that it has helped me to justify to myself that this is a topic worth spending time on. Having a fellowship has meant I felt more able to approach contacts working in the relevant fields as a researcher, rather than someone who I felt is just interested in the area. Having these conversations, as well as the peer support from other interns and pre-docs, has helped me find confidence in articulating my research idea and helped to build my resilience and knowledge around the infrastructure and support for research delivery. There have definitely been challenges along the way, particularly with regard to time when undertaking my research fellowship alongside work. It's still easy to get pulled into everyday duties and demands. I know that the timeline I'd set for myself at the beginning of the fellowship is not something I was able to stick to, as a number of the objectives also relied on contribution of others who were not able to commit to my timing, as well as my own external pressures. A huge insight that I've had from this fellowship is the need to build in time to developing my research skills through courses, workshops, webinars, and so on. I think I'd written a timeline that didn't fully account for the time needed for development of myself as a researcher, as well as the actual work of research. This is a key learning that will take forward to planning doctoral studies. Another challenge was the large volume of literature that's been written in my research field, although not directly applicable, meaning that the time for screening was much longer than expected, and so my review remains ongoing, so that I could focus on other aspects of the project. The fact that this was not completed might have contributed to the rejection of my abstract submission to the European Society of Medical Oncology conference. As I mentioned, I've done various aspects of PPIE and can understand the demands on people with lived experience are high, so facilitators can be keen to protect them. However, this has led to difficulties in me being able to engage with my target population. The feedback I've had suggests that this is a really important area, and also an area where there is a gap in the knowledge, so I'm refocusing on this objective and building longer timelines to ensure that I can address this in my PhD application. At times I think it would be easy to focus on the things that haven't quite gone to plan or the timing that's slipped, but preparing this presentation has been a great opportunity to reflect on the fellowship year as a whole. I've learned skills that strengthen my ability to develop a systematic literature review protocol and publish that on the Open Science Framework. The review itself is ongoing, and I'm committed to publishing this in full, as well as using the insights to develop my doctoral application. The quantitative survey of oncology professional views has been hugely helpful in understanding the preferences of people that would be likely to deliver a pharmacogenomic intervention in practice. As well as providing insights into an aspect of research that was lacking, I was able to present this as a poster at the British Oncology Pharmacy Association, and the abstract will be published in the Journal of Oncology Pharmacy Practice. More broadly, I feel that I've developed sufficiently to have the confidence not only in my own research idea, also to support others, particularly other pharmacists, to develop their own research careers. I've joined a Northwest Pharmacy Research Advisory Group, which is trying to promote research as part of the pharmacy profession and help others to develop their research careers. I've been able to use my research findings and new skills to support my application to the first stage of the Forward North PhD programme. I've since found out that I was successful at stage 1 and been invited to progress to stage 2, which will be due in January next year. So just a final thank you to everyone at the NIHR ARC in Greater Manchester for all your support. Thank you very much.